We're continuing with the cardiovascular system. The lecture today is about the pathology. The pathology today that we'll discuss is atherosclerosis. So let's look at the structure for the lecture today. First we'll talk about the epidemiology of the lecture of the atherosclerosis. Then we'll talk about various risk factors and what factors are controllable versus what are the ones that we cannot control. We'll also talk about the clinical aspects of the atherosclerosis. I mean, what kind of clinical diseases that you'll see. Out of those, the most important is ischemic heart disease. We'll also talk about the pathological progression of this disease and a concept that is called clinical horizon, and what does that concept mean. We'll talk about that here. Once we've done that, we'll talk about the actual cellular and chemical mechanism that is observed as this disease, as this pathology progresses. So that is the structure. Let's start. First of all, epidemiology of this disease. Ischemic heart disease is responsible, or atherosclerosis and the related diseases are responsible for about half of all the deaths in the Western world. It is also interesting that within United States, so again we're talking about the USMLE, within United States, a quarter of all the deaths every year are because of ischemic heart disease, which again is a problem that happens mostly because of atherosclerosis. For the atherosclerosis, there have been a lots of research and lots of progress to try to contain it or prevent it or cure it. So far we have not found any mechanism to actually just eliminate this. However, there are ways that we figured out to either reduce the progression or try to heal it a little bit. It never stops. It's a progressive disease. So what is the disease? Let's start with the definition of that as well, so then I can talk about the stats here. The definition of the atherosclerosis is it is a intimal disease. It is a disease of tunica intima, of large and elastic vessels. That is the basic problem. The tunica intima, remember, can you visualize a pimple? Imagine in the large vessels, there are a bunch of pimples that are showing inward, and those pimples can either block the vessel or they can rupture inside the vessel and cause embolism or thrombosis and so on. So that is the basic problem. It's a disease of tunica intima, of large elastic vessels. Now, in the US, the death rate of this disease or by this disease has actually over the years since 1963 has reduced to half. So the death rate is actually declining. Even then, in the US, the largest reason for the cardiovascular diseases and deaths due to cardiovascular diseases is the ischemic heart disease, and atherosclerosis is the contributing factor. Now, in the stroke related diseases, which again deaths, which again most of the strokes are because of atherosclerosis, the improvement since 1963 to 2000 is about 70%. So 70% stroke related deaths have become reduced since 1963. Here for the ischemic heart disease, 50% of the deaths have been reduced. So that's a great improvement. And now there are some factors. Before we look at the factors, first let's see what is the clinical impact of this disease. What does it do? So look, here we've gotten the heart, and of course heart has gotten its own blood supply. There are coronary arteries and then their branches are there. This is the left anterior descending artery, and that is the obtuse descending branch or the marginal branch, and this is acute marginal branch. The point is we have blood supply of the heart here. Then aorta starts. So here is the aorta. This is aorta. From the aorta, there are renal arteries that go towards the kidneys. Then, if you see, there is the blood supply towards the lower limbs. This particular disease, atherosclerosis, is not a random disease that can happen anywhere. It has a very set pattern which we do not know why. but our postulation is that it occurs in the area of the vessels where the blood turbulence is present, where the blood is flowing in a turbulent way. So what are the areas? So please remember this. This is your most important part of this lecture. Abdominal aorta is the most common occurrence of this disease, or is the area most commonly affected by this disease. So that is one, abdominal aorta. Now, would that involve the renal and mesenteric vessels as well? Interestingly, no. Although the beginning part, the openings of these are involved in the atherosclerosis. So the intimal disease, the problem with the intima does happen to the beginning part of the mesenteric and the renal vessels, but renal arteries and mesenteric arteries are not affected. Abdominal aorta is affected. That is the most common site. Second most common site is, voila, coronary vessels. That is the most disturbing thing as well, because this is the cause of death. This is the 50% of the people dying in the Western world are dying because of the diseases of the coronary vessels or ischemic heart diseases, which are because of atherosclerosis. So again, this is a very important disease we're talking about. Third largest is the popliteal, believe it or not. Popliteal vessels, popliteal artery, aneurysms and thrombosis is the third largest site, third most common site where the atherosclerosis affects. And fourth, I think you have already been thinking about it.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.